Hi, my name is Greg Felt, I'm Director of Public Health in Sheffield. This is a brief update on where we are with regard to vaccination today, 12th of January. So there's been a lot in the press about the safety of the COVID-19 vaccines. I'll be categorical about this, like to reassure everyone that the vaccines are safe, full stop. The NHS won't offer vaccines to anybody until the regulator, the Medicines Healthcare Regulatory Authority, have approved any vaccination as safe and effective. I have full confidence in the MHRA's judgment, and the MHRA have said that they're safe vaccines, therefore the NHS is using them. Really clear about that one, and they're highly effective as well. So as with any medicine, vaccines are highly regulated products. They go through several stages of lab tests, clinical trials, before they get anywhere near use in humans. And the vaccines have been through those tests. And there's continued monitoring once the vaccination has been authorised and is obviously now being used in a much wider population. The purpose of the vaccines are designed to prevent people from getting serious infections, and it's much safer to allow your immune system to develop an antibody response through vaccination than it is by catching the illness and developing an antibody response in that way. I'm encouraging my family, my friends who are eligible to get the vaccination. I'm really clear about that one. How long will it take for eligible people to get vaccinated? It will take time. Be patient, and please don't contact your GP. The NHS will contact people when they become eligible, and the NHS is working through the list of eligible people in a specific priority order. So please don't contact your GP, they will contact you. It's fair to say that the availability of the Oxford AstraZeneca vaccine is a game changer, and will significantly accelerate the delivery of the vaccination programme, but it is a huge logistical effort, and with the best will in the world, that will take some time. So far, we've got 15 vaccination centres being run by GP practices. They're up and running now. They're vaccinating the over 80s in 95% of Sheffield's GP practices, and the centres are also vaccinating the over 80s GP staff, care home residents and staff. So those are the initial priorities, and that's where we're focusing our energies and efforts first, very deliberately. So the Oxford vaccine, as I've said, the Oxford AstraZeneca vaccine, it is a game changer. It's easier to transport, easier to store than the Pfizer vaccination. That doesn't mean the Pfizer vaccination is not a useful thing to have. It's very useful to have, but the Oxford vaccination is easier to use. Thus, it makes it easier to deliver in care homes and to people who are housebound. Sheffield has received its first doses of the Oxford AstraZeneca vaccine last week, and has started using that in practice and has been delivering it to care home residents and care home staff. Really helpfully, we don't have to, the MHRA have just slightly amended their regulatory advice, and we don't have to now have patients being observed for 15 minutes after the AstraZeneca vaccine, and that makes it easier to get more people vaccinated in a certain space of time. We're expecting as a city to have the majority of care home residents vaccinated by the end of January. We're pulling out all the stops to make sure that happens. So on the rollout, it's the biggest vaccination programme in history, and as I say, it will take time to get through all the eligible people and to fully vaccinate those that we want to vaccinate initially. The supply of the vaccine is coming through in small batches, which means the NHS is rolling it out wave by wave. It's fair for me to say that our GP practices in Sheffield and everywhere else are well used to delivering tens of thousands of flu vaccines a year. They do so year in, year out, and that works really well. So we're adopting, in some respects, some similar mentality. It is a marathon, not a sprint, and it will take some time. Based on our current forecasts, and things will change over time, but we estimate that we'll be able to get a vaccine into all those that the Joint Committee on Vaccinations have said will benefit by late spring is our best estimate. The NHS has the capacity and trained staff to deliver the vaccines, but it's fair to say that the vaccine shortage is a reality and that can't be wished away. We're managing that as best we can, and we're pushing as best we can with the constraints that we have. A lot of asks in my inbox and elsewhere about the second dose. The national guidance has changed. So there'll now be a 12-week period between doses, and that means that we'll be able to get the maximum immunological benefit for most people in the shortest space of time. If the aim of the programme is to save as many lives as possible, then it makes more sense to give more people one dose than half that number of people 2 doses. The chief medical officers are really clear about that. That will have the greatest impact on reducing mortality, severe disease, hospitalisations, and the evidence is really clear that one dose still offers a very high level of protection. That recommendation was from the Joint Committee on Vaccination and Immunisation. I support it. I've been through what they've said. I support it completely, as do, I think, the medical professionals in Sheffield. So we do recognise, however, that some people, the longer wait will be worrying. The longer wait between dose 1 and the second dose will be worrying. And clinicians do have the discretion to vaccinate people with the second dose sooner if they think that's needed. If you have an appointment for the second dose and you haven't heard that it's been cancelled, then please turn up as planned. If your second dose has been cancelled, you will have been contacted. So if you haven't heard, please turn up as planned. I should say, getting both doses remains really important. The thing that's changed is the space between dose 1 and dose 2. It's still really, really important that you get both doses of the vaccination. So when you get your appointment for dose 2, please attend. Which vaccines are currently available? There are 2 available to the NHS at the moment. One is the Pfizer and BioNTech vaccination. The second one is the Oxford AstraZeneca vaccine. Both of them are available. Both of them are in use in Sheffield. Both have been shown to be safe and offer very high levels of protection, and both have been given MHRA approval for use. We are encouraging people to not think that they can pick and choose the vaccine that they want. Both are effective and both are safe as judged by the MHRA, and the rate limiting step will be the vaccine availability. I would have either of the 2 vaccines, so we're encouraging people not to be picky and choosy, but to take the vaccine that is available when their appointment is. Last point, how will people be invited? So when it's the right time for people to receive a vaccine, they will be invited. For most people, that will be in the form of a letter that either their GP or the national booking system, and that will include all the information they need to bring with them to the appointment, and on the letter will be your NHS number. I'll say again, it is the biggest vaccination programme in UK history. It's probably one of the biggest logistic exercises the NHS will ever undertake. It will take time, and there's no 2 ways about that. I know full well there are lots of people eager to get vaccinated as soon as possible, but we are asking people not to contact their GP to get an appointment, but to wait for an invitation.